Thank you for joining us for FSHP's Medication Safety Podcast. Whether you're a hospital or a specialized pharmacist, a technician or intern, a director or executive, medication safety is important for all members of the team. With the continuing work and vision of the Florida Society of Health System Pharmacists, a new clinical forum was created to share, discuss, and educate on topics regarding medication safety. This podcast will cover the practice and experiences of varying pharmacists in their realm of health systems. My name is Alex Shantiai, and today we will be chatting with Dorothy, Heather, Krista, and Nisha. Thanks for joining us today. So, tell me a little bit about yourself and your current position. Maybe you can even share something you enjoy or love about pharmacy.
Hi, thanks, Alex. This is Dorothy Fox, and I am a pharmacist currently residing in Indian Rocks Beach, Florida. I've been a pharmacist for 29 years, believe it or not, and I am currently the Senior Corporate Director of Pharmacy with Comprehensive Pharmacy Services. What I love about pharmacy is just that it has become so diverse that anyone can find a niche or a practice that they enjoy and pursue that. And we're just continuing to expand constantly. And so that's pretty exciting for our profession.
My name is Nisha Mathew, and I've been practicing as a pharmacist for about 16 years. I currently serve as the Director of Medication Safety Services for Cleveland Clinic, Florida. And we are approximately 1,100 hospital bed system with several ambulatory sites and 11 pharmacies. And when we speak about pharmacy, and what I love about it is the flexibility within the profession, just like Dorothy alluded to, the growth that we have within the profession, and our ability to serve as trusted healthcare professionals, as medication experts for, our people and the people in our communities and in our health systems. I love that we're pursuing our status and recognition as providers and bringing together like a culture of safety and focus in how pharmacists serve in that realm, and how also medication safety works with quality as well as operations in ensuring that we take care of the patient as a whole.
I'm Heather Petrie. I am in Titusville, Florida at Parrish Medical Center. We are a small independent hospital, about 200 beds. So we kind of bring a different variety of type of hospital. I was a long-term care consultant pharmacist for 3 years, and then I've been in hospital pharmacy for about 9 years, so 12 years total. I've worked as a pharmacist. I'm currently the clinical manager at Parrish Medical Center. With the profession, I feel like we're a continuously evolving profession with a variety of opportunities now and also moving forward. It's always kind of continuously changing. So I think that's a real bonus within our field. And I'm looking forward to the changes that come in the future as well.
My name is Krista Riveron. I am the Medication Safety and Quality Coordinator at Boca Raton Regional Hospital, located in Boca Raton, Florida. We're a 400-bed hospital, and we're part of Baptist Health South Florida, which is about 14 hospitals in the South Florida area. What I love about pharmacy, and especially in this role in particular in medication safety, is that there's a variety. It's not redundant. I see different things every day, and medication safety touches so many different facets of the healthcare industry and processes. So I get to see operations, I get to see clinical sides of things, I get to see technology and informatics. And so I come to my job excited every day because it's different, and there's nothing boring about medication safety. I took a different path to get to this role. I graduated in 2019, and I've only been a pharmacist for about 4 years now. I was actually in law before this, and then went back to school and became a pharmacist.
Welcome all. Well, thank you all so much. I know you can provide such amazing perspective. Let's go ahead and dive into it. So my question is, can you give us a little bit of background about what exactly medication safety means? And how does it relate to your professional setting?
I like to focus on a combo of creating safeguards to help prevent medication errors and also empowering the pharmacist to speak when they see a potential error or need to intervene. And this is all ultimately to protect the patient.
To me, it means a little bit about identifying gaps within the system especially monitoring high-risk medication errors, any near miss events that could have caused significant harm that just barely escaped. And then also like looking at adverse drug reaction events concurrently to see if we can monitor and change the patient's therapy or even prevent any kind of future errors and thus decrease your length of stay, better care for the patient. I look to it as, pharmacists are medication experts, and we can be part of the multidisciplinary team to make sure that we have recommendations and solutions and what kind of redundancies or we can build into the system or where we can pull guidelines from in terms of evidence-based practice or patient safety organizations to augment our systems. And in addition, like take away a culture of shame from medication errors to say that, sharing the mistakes is actually learning because what one person might not realize is an error, sometimes an error of omission. You're teaching them that this was an opportunity missed and this is an error. And so then you're able to share that within your system and fix and also bring better care for your patients.
Yeah, Nisha, I would agree with what you said, but also really for me, medication safety is really understanding the entire medication use process and the fact that it's beginning at procurement and doesn't end until monitoring. But in all reality, it really doesn't even stop at the monitoring. That's kind of where we stop as hospital pharmacists. But I think we have to think about our outpatients and our folks in retail and how the impact of how can they be safe at home? What can we do to help them understand how to take it correctly, how to appropriately secure their medications, and then appropriately dispose of them. Those are some pretty big risk points when they leave our facility. And I think we have a responsibility along with our physicians and our nurses to educate our patients when they're going home and just not really to forget that piece of it. But to Nisha's point as well, we are not involved in every step of the medication use process as pharmacists. So it really has to be a collaborative effort by anyone who handles medication. And having those conversations, creating that just culture in your organization so that people are free from feeling guilty or shameful for making a mistake, but bringing that forward to you so that you can fix them.
You mentioned the duties of a pharmacist in maintaining safety. Do you mind explaining how medication safety falls on other caregivers or other disciplines?
I work a lot with an interdisciplinary team. I have medication safety meetings where I meet with both nursing and BPs and respiratory therapy and nutritional support. So a whole lot of disciplines in order to support as a whole, as mentioned before, the medication use process. For example, other disciplines, I work a lot in the oncology space. We do a lot of inpatient and outpatient oncology and medication safety. Those are all really high risk meds, high alert meds, dangerous meds, and have really big side effect profiles. Working especially with the nurses and nursing leaders and in that aspect, I like to think of this role as being, so sometimes you have to be reactive in the role. You have to do a root cause analysis in order to find out why something happened and work with a team to be able to come to a determination as to what the cause of an error was. But we do that in order to be proactive. And that's what I really love about the medication safety space is that in the end, we want to be proactive and want to prevent patient harm and do the best for our patients.
I was also thinking of it from a medication history perspective. Medication history collection in the hospital setting is kind of a constant struggle as the source of the information is not always accurate. It's important for caregivers to keep an updated list. So I was thinking from caregivers from the point at home with the patients that when they are coming into the hospital, making sure an updated list of medications and communicating that to help continue the safe and continuous care at the hospital. Also, nurses working to ensure we have an accurate history is taken. Pharmacists and providers needing to question unusual dosing and looking at alerts and really analyzing what's going on to make sure we have accurate medication history for our patients. Because really, if we don't have an accurate medication history, it's kind of hard to treat the patient as they go through their hospital stay and also to discharge them as well. So obviously, in all hospitals, this is an important piece, but we've been really focusing on to improving that process in our hospital.
If I could add on to say, those are excellent points on med history and transitions of care being a critical area where pharmacists and pharmacy technicians bring in value. When you say how it falls on other caregivers within the team, when it's everybody's responsibility, sometimes there's no accountability on whose actual responsibility it is. Yet at the same time, when we share medication safety areas and opportunities such as med histories and transitions and keeping medications safe, we can also allude to our technicians in the pharmacy being aware of some of these in how they identify dispensing errors or lookalike products that might be easily mistaken and how the need of additional labeling may help them. Or if it's a critical care ER or ER pharmacist who is taking care of emergent patients where quick decisions, fast action is needed, their knowledge of some of the safety principles and high risk medications adds to the team in stopping and validating and checking to make sure it's a correct dose, it's a correct medication when our instinct is to, in a pressure situation, take care of the patient as fast as possible. I also feel whether it's your med-surg pharmacist on the floor or your inpatient pharmacist, compounding is a significant area where you can make easy mistakes. And if you don't have a diligent pharmacist and technician, and they're not aware of some of these errors can get to your patient, I feel that these are integral pieces of our medication safety systems and roles within the hospital or health systems in continuing to be diligent and being able to catch your near miss to say, this is what contributed towards the near miss, and then involving that person to say, what would have helped prevent that, and giving them a voice to make change in their system. So I feel it falls on everybody within the system to catch whether a medication is stocked in the incorrect bin on the floor or in a Pyxis machine, to inpatient pharmacy or your nurse who's administering the medication and notice that it was a labeling error. This is where I feel your culture of safety comes into all disciplines participating with medication safety.
Absolutely. That's very insightful. Thank you, Nisha. We're all on a team and it's all up to us to catch the errors together. I want to segue a little bit to a term maybe we don't want to talk about too often anymore, but we still have it relevant in our own society. So COVID. COVID is a term we have heard and talked about all too often, but we can't deny it. It really has changed things, especially in our hospital settings. Things like burnout, workforce changes, regulations. We hear words like this regularly. What have you seen different in your setting? Any unique perspectives to share?
I think overall, everyone in healthcare is absolutely exhausted from the events of the last 2 to 3 years. I think that's safe to say. Staffing is a major concern really across every discipline, especially as we hear about the nationwide nurse shortage, unacceptable nurse to patient ratios that could contribute to medication errors. It is important, that we're recognizing this burnout, but at the same time, we don't lose sight of really what's important, and that's ultimately keeping our patients safe. Working with our caregivers at the bedside, making sure that they don't create workarounds for something that's not working or shortcuts to get the job done because there's not enough staff. And that applies also, in the pharmacy space. Pharmacy technicians, vast shortage of them, especially hospital trained technicians, are difficult to hire and they're difficult to retain. And the ones we have are very, very busy. And we really need to keep the focus on med safety with our teams to ensure that they're not creating those shortcuts and workarounds that could certainly lead to an error. And make sure they're taking care of themselves as well. That's very, very important nowadays.
That's a really good point. Leading into recent safety practices, I am wondering, Krista, what have you seen in your work for your setting?
I mean, for us in particular, everything that Dorothy said resonates with us as well. And just the efflux of healthcare workers out of the healthcare industry and to other things, nursing, and it goes beyond that, laboratory technicians, phlebotomists. And then in our particular system, in order to compensate for that, because you still have to have employees, we've had a lot of traveler workers that are only here on a contract for a very short time, 2 months, 3 months, and they're not familiar with our processes, our procedures, our formulary, our medications, and our number of medication incidents did increase during COVID times due to patient burden on nursing workers that weren't familiar with our hospital and our practices here. So that really did put a big strain on us in particular, was the amount of traveler employees that we saw.
We did a newsletter Pearl on this, and we talked about shortages of people, which is obviously a big focus, shortages of medications and shortages of beds. And medications, talking about there's alternative products that we've had to buy that maybe a lot of our pharmacists are unfamiliar with, even to teach the nurses how to use it if it's something a little bit different than what they've seen. Also, shortages of medications. We've had a contrast dye has been a huge shortage, and that's probably delayed some diagnoses of some patients because that's backed up appointments. People are having delayed diagnoses of for different illnesses that they might have that have come about. And then shortages of beds. We actually highlighted the Mayo Clinic's program called Hospital Without Walls. And it's a very unique thing that's kind of evolving more in Florida and other states as well, where it's really less critical patients are going home, and they can do kind of a med tele thing with the pharmacist and the nurses at the hospital. And then there's an outside vendor that delivers medications to the patient. So it's a really unique style. And I really just wanted to highlight that because I think the Mayo Clinic's doing an awesome job with that. But I also know Orlando Health has been involved in that system as well, and probably some of the other bigger systems too. It's obviously affected the healthcare system a lot over time.
If I could add to that, I was going to say it's certainly interesting to see the Hospital Without Walls model take shape as we look at flexible options of staffing and retaining staffing, to see one solution doesn't fit all. If patients prefer to stay home and they can be taken care of at home, let's do that. And I think it opens up the door of flexible work patterns, yet ensuring their safety, like in your medication delivery, to make sure we're still providing the same care for the patient. I will add that with COVID, like we've seen a lot more about wellness and mental health and resiliency at my health system. While we still take part in what we call care at home, we've also started celebrating more of the patient safety heroes and giving medication safety awards to recognize that people are still doing great and excellent care with the resources they have. And we want to celebrate those who are staying and partnering and doing the work to take care of patients, whether it's a good catch or an error that led to change. Recognizing and providing that feedback back to our frontline caregivers or employees with leadership and executive recognition has really helped make feel the employees that, hey, we're valued, we're part of a system that's still seeing us, even though we have a lot of resource restrictions or strapping, and we're trying to do the best we can. I think it's also made okay, like the second victim response, to say, as humans, we're not expected to be perfect. We're going to make mistakes. If errors are happening, it's not necessarily the human intending to cause harm. So why is the system letting you do it? And how can we look at some of those system settings so we can take the blame and that victim culture away from putting humans in situations where they're not resourced enough to do the work? I can tell you one of the programs that I thought was very effective was called the Helping Hands program, where nurses and administration or whether pharmacy staff could walk through some of the huddle areas, or depending on whatever project and resource-starved areas were going on, donate some of their time to help as additional helping hands, whether it is an intake form or making sure like some patients get water or offering blankets. So multidisciplines helping each other to take care of patients.
Clearly, we are still seeing the effects of COVID, as you mentioned, from workforce to shortages, but we adapt. And I think we're starting to get a good grasp of things. However, I'm wondering, How do we disseminate this knowledge to others, at least in your network? Is it meetings, continuing education, emails? What practices do you utilize in your institution?
When I was chair of our medication safety committee, both at the hospital and then as our division chair, we would publish a quarterly newsletter for medication safety. And that went out to all staff at each hospital in the division. We made sure that we had something in there that was pertinent to disciplines outside of pharmacy as well as pharmacy items. So we had a few things targeted at nursing, a few things targeted at physicians that would really be meaningful to them. I would also share the ISMP newsletters when they came out, send those out to pharmacists and nurses, and just made sure to highlight any info that might have been especially important to us. But we also did medication safety rounds. We rounded quite a bit and titled them Med Safety Rounds. The conversation was not just me telling them how to be safe or what we're doing, but it was also asking. My favorite question is, what's the next error that's going to happen? What do you think it is? And I think if you ask that question to your bedside caregivers, you're going to be surprised by the response that you get because we don't see that as pharmacists. We actually won an ISMP Cheers Award for this particular piece in creating and disseminating our knowledge. So that was pretty exciting.
We've heard a lot, but I love to end it on a fulfilling note. I think our audience has learned a lot. We've only cracked the surface, really. We've heard your introductions, but finishing on a thought-provoking note, I love to hear, what's a memorable moment or a proud story you love to share working as a pharmacist in your setting?
Love the question. Love to keep it thought-provoking. I can tell you from working almost 9 years from med safety, like this was a pivotal story or an event when, as we were looking into a series of ANSEF-related errors for each patient and doing some investigation where it was a novice and a newer nurse caregiver who came to me in confidence and said, I think I made the mistake and this was me and I was distracted and this is what was happening. I think to me, it was an effective moment of somebody being comfortable to say, I'm struggling with this. I feel like I won't be respected, but I feel safe coming to you to say, this is what I think likely happened and how can we move on from this? I believe that when we empower people to do that, that's when systems begin to change and safety becomes a focus and we can take best care of the patient. That is one of the key moments in my career that I will probably look back on and be happy that I was there at that spot at that moment.
I think for me, it's honestly when you realize that your message is resonating and being captured throughout your organization. People change their bad habits. They're proactively reporting workarounds that they're having to do. You see an increase in medication error reporting because they feel safe, as Nisha was talking about, in your just culture environment. You're changing the dynamic from reporting and having med errors to proactively as a team preventing them. And that for me was my most memorable story.
For me, it's being able to see directly the patients that we impact, especially in this role. We had one patient that will stick with me forever. I got involved in her chemotherapy. She had a little esophageal tumor and she couldn't swallow. And the only treatment for her were oral capsules. We had to take these capsules, go into our IV room and crush them with sucrose solution and make it something that could be administered through her feeding tube. We did this for this patient both while she was admitted inpatient and also on an outpatient basis every single day for over a year. This patient, one day I got to meet her in person and she started crying. She thanked us, made us a gift basket, and seeing the impact that we had on a particular person's life and how we can do things, how we can do them safely, how we can affect people, that's really what's made the biggest impact on me.
I would just say on a daily basis, I really enjoy being able to intervene on certain things. If I can help improve something in our EMR or help implement a process with our team, with being in a smaller hospital, everyone feels pretty comfortable with talking to each other about different things that happen and how we can improve it. This is kind of not as big of a story as the others, but the ER recently had an incident where a provider ordered an antibiotic for the wrong patient. So they DC'd it, and the nurse thought it was a one-time order that just discontinued itself instead of the prescriber discontinuing it. And she actually gave the antibiotic to this patient. I worked with informatics to ensure that the orders could look differently in the EMR system. We have a bit more of an archaic system. Sometimes some safeguards are not in there. So I really enjoy being able to intervene and work with other teams to create changes and impact on the system.
Very thought-provoking stories. Definitely a lot to take from. But unfortunately, that's all the time we have today. And I want to personally thank Dorothy, Nisha, Heather, Krista for joining us today and sharing their stories. You can join us here at FSHP with our socials as we learn more about our Florida members and their practices.